Save one life, you're a hero. Save 100 lives, you're a nurse. I am Nathan Yeshua, and this is Nursing Unscripted, your one-stop guide to the journey of nurses. Today with me, I have a wonderful guest. Someone I'm proud to know personally, a mentor, a lecturer at Obafemi Awolowo University, a community health advocate, and an all-round wonderful person, Dr. Ogunlade. Nice to have you today, man.
Thank you.
Thank you for your presence here. And we'll just get straight into the conversation. From the initial stages of your journey, what inspired you to choose this path in the first place?
Okay, I always know that I did love to care for individuals, especially when I see them in problems or things I know they might not know how to handle. Let me give an example. A woman carrying a baby and the baby has fever, I would have loved to know what to do to help the woman or the baby. So I think that tilted my mind towards the care profession. Which care profession will I now go to? Okay, so then as I grew, my grandmom was living with us. So I discovered my dad just picked me to be, will I say to be a nurse?
A caregiver.
So he mandated me that I must ensure that his mom take his bath at her advancing age. That was close to 100 then. Because the woman can bath for more than 3 times a day before. But later in those years, she would not even bother. So my dad mandated me. So I guess from there, I tidy up our room. That actually led me to being a nurse. And at the time, I also noticed that the path of being a nurse is short. And I think I possess what it takes to really go through that path. So I guess that was why I chose nursing.
So now in this journey, you mentioned how you were able to decide the path exactly in caregiving. So now about the educational system. Sometimes people decide, okay, this is my step, this is my journey towards education. So what was your journey towards attaining this position you are currently at?
Actually, while I was in secondary school, at that level when everybody starts saying what they want to be, there was this my friend that said she'll just be a nurse and go to school of nursing and all of that. And I said, oh, that's a shorter path to achieve what I want to be. And I think I just fell in love with that path. And what does it take to go to school of nursing? We were told that it's going to be also be 5 level credits, which I have, and maybe some other things. The university part was there, but not well known like that part at the time. Because I could remember, even when I was in year 3 in the School of Nursing, I came for my elder sister's convocation here. She graduated from English Arts then. I went to look at the convocation book, nursing department. I saw just one name. One name. And it was a pass in front of her name. And you know, the convocation booklet will have second class, upper district, and all of that. So I saw one name and I saw pass. I was like, wow.
That's shocking.
Wow. What does it look like? So I started asking questions, not then, but when I now got into OAU, or when I met individuals that I also had a cousin too that was studying pharmacy at the time. So I asked her, what is nursing like in the university? Let me just keep that. So I just followed that path with the hope that at a later date, maybe after completion, I know there's a path for direct entry to study nursing at the higher level for the degree. So I just said, okay, let me start with that. Maybe by that time, things might have gotten better to be easier to navigate.
Oh, that's actually great. So now, transitioning from the clinical setting to the academic setting, what was your major drive, and what was the major thing that made you decide, okay, I'm done with the clinical setting, I would prefer to be in the academic system?
You don't just jump from being a clinical nurse to be an academician. The path has to be that, yes, if you have that dream, then you must attain the first degree, the second at least, even if you have not attained the third. So you must have the second, and our second in Nigeria then, even till now too, our second then was, when you have that, it has to do with research based. And when it's research based, it's towards academics. Okay, so when you have that, you might say, okay, your path is tilting towards academics. And I've always loved that. I wanted to be that. That was why I left the School of Nursing to pursue the BNSC at the time. And the clinical setting, when you are somewhere and you could see that I can do more, I can do better than this. And it's like you are in a place where you think your brain could expand more to give more, then why are you there when you are not even allowed to? Sometimes you are not allowed to manifest what you have. You cannot, yes, you cannot even, something occurring to you that you could do and it could work out well, but because of the way the structure is, somebody will say you have to do this, it's not written somewhere before you could do it. Then I just know it's not, maybe I'm not meant to remain there. One day or somehow, one is going to leave. So I went on to have the PhD too. And our PhD in Nigeria has to do with being research based and is not the doctor of nursing practice like we have in some other places. So since he's a doctor of philosophy, if he's doctor of philosophy, then it's an academic path. Okay, so since he's a doctor of philosophy, then definitely what will that achievement be doing at the clinical side? So it's better to navigate academics. However, if I really have the passion to stay there, then definitely I will be a lecturer somewhere while still working at the clinical side. Okay, so the two could work together depending on one's goal and the path or what one prefers. And if I must confess, that night shift
is about to handle. So, you mentioned something about the structure and everything in the clinical setting.
Okay.
There was something that could have motivated you to still be there, a change that could have been made in that structure. Do you have any particular structure or change that could have kept your passion for the clinical setting?
If we had what we call doctor of nursing practice here, maybe I would have stayed because I would have loved to be a family health nurse practitioner. Wow. And, the family health attends to the entire family. And the path I took for the doctoral part, my research has to do with something in family health. So I would have loved to stay there to really work on that process and also impact. And family health nursing is not something that is common in Nigeria. So if that structure was there, maybe I would have.
That's actually great. There is this belief that the clinical setting offers more exposure, while the academic setting has more flexibility. What's the truth about that?
When you say exposure, can you define that exposure?
Exposure in the sense of how well you get to have first-hand experiences with different clinical scenarios, different patients, different diseases, and the cure and solutions to those problems.
And when you talk about flexibility, what does that mean?
And flexibility in the sense of the time you have at your hands, the ability to maneuver around different things.
I would say that it depends on individuals. Because sometimes there could be that flexibility at the clinical side. Because when you go to, there's a way the roster runs, or the schedules, the work schedule, there's a way it runs. In some places, they work for 5 days, if it's on morning, and you have 2 days off. There are some days that, if it's afternoon, you might work 5 days and have 2 days. Some nights might be 7 nights, 7 nights off, that is days off. So for an entire week, that's also some free time. And in places where it's just, the night is just 4 days, you have 4 free days to you. And going for afternoon, you are free in the morning. Okay, so that time too might be there for the clinical nurse. But for being a clinical nurse, yes, you are right by saying the exposure at the clinical area. You have the opportunity to see different Different patients depends on which area you are.
Serious.
But you might say different cases. Somebody in the labor ward might see different cases of women in labor. Somebody at the emergency, you see series of different patients. Okay, I don't know if I've been able to
Understand what you're saying.
Okay, so depending on where you are, you'll be able to see, but yet you are exposed to patients' life, patients, and your brain, your attention, the skills you have will be put to practice and work in those different places. And for the academician too, yes, if you have that background first, makes it easier to navigate and also put some things in perspective in building research. I mean, when you want to develop a research plan and it has to do with the hospital or the patients, you have some background about what and how to navigate successfully. And also, you will have the ability to know some things to put in place to help the patient more. And also to teach. It gives you the ability to give life examples.
Yeah.
Okay. So, but I will say that the academician might have a more flexible time because the classes, though they have more responsibilities. Because I was opportune to see a picture that says what an academician does, like a lecturer. You teach, research, community service, and a series of things, much more than what is being done at the clinic, especially. When I say clinical side, we are talking about our setting in Nigeria, because in some other places, you could also do research at the clinical area to improve the practice and generate evidence that one can also use.
Okay, still on the flexibility and exposure conversation. It's easier for you as a lecturer to decide when and where you want to have your classes, and there are some certain restrictions attached to being the clinical nurse. How does that affect? How did that affect your decision into transition?
Okay, one thing I observe is no matter the years of experience you have, you must always get to work at the time you're expected to be there, especially when it's the mornings. 8 a.m. or 7:30 or 7 a.m. depending on the setting. That morning. why the squeeze of this?
7 a.m.
Yes, sir. Depending on the facility, it can be 7 a.m., can be 7:30 or maybe 8 a.m. So you have to be there at that time because you don't want to keep the night nurses waiting, except you have somebody to stand in for you. And that's something that puts pressure on many women. Maybe, am I not genderly biased now? Many women, especially those that have younger children, to care for. Dropping at school, some, they're the ones that would drop the children at school before they come to work and all of that. Sometimes it can be very cumbersome for them to navigate. The night shift too, for these days that, there's committed families here and there. When I say committed families, the husband works at a different city, the wife works, and the children are likely going to be with the wife. And if the wife is a nurse, to go to night shifts, maybe looking for carers, and if it's a space that will accommodate them, you can see the level of burden. So all of this, actually thinking about it and navigating that path, if there is a more baby girl path, I choose it.
So we can now conclude that the academics is, a more baby girl path for us to dive into.
And let me add this, that the academics still gives exposure beyond patients. It exposes you to more different types of research designs, research grants, and networking beyond your own institution and also internationally too.
Wow. So now we know that to some extent there are some certain bias that determines how a person makes decisions. It could be financially or towards the reward as a professional.
Yeah.
Which part is more financially and professionally rewarding?
When you talk about reward, it's depending on the particular individual. whether you are a clinical nurse or an academician, I don't really think there is that difference, the margin. I'm not really sure that margin is so wide in the pay. Okay, the difference in the so financial rewarding, I don't really think there is a difference in the financial reward for either of the two. Okay, but as soon as you get to a particular level, I don't think there is a difference. Even a professor, by the time you become deputy director, you're more, I think you're almost any or even more. Or even those at the best might have more because they have different allowances. Those doing on call
Actually,
might earn more, maybe. But the reward for financial reward for lecturers can be the opportunity to do maybe work for some other institutions in different capacities. Okay, maybe that can increase. Then get research grants, which is not really your need. Okay, that's good also. But for the pay, if we are considering just the job, that's the lecturer, and the margin is not really wide.
So that answers the question that you may have about the financial aspect, because I think that that's a very key determinant of people's choices. There might be individuals that,
although it's rare, there might be individuals that might want to also do both sides simultaneously. How difficult is it, or what are the main determinants of how well a person can be able to juggle both sides, or is it even possible?
Let me start from the person at the clinical side. The person at the clinical side could juggle those let me call it 3 days. Those days the person is not on duty, could see go do, depending on the institution. But in Nigeria, you can't work in 2 institutions together that way. You can't be paid by the federal government in 2 places at the same time. Let me put that straight. So and also the state government, maybe you can work at the federal. I don't know if that's possible, but if somebody wants to do that, it has to be with a private institution. Okay. However, for the lecturer, you can choose to volunteer. Like also those that are also at the clinical side can do what we call pro bono. They will not be paid, but he can also do it. They could do the lecturing job too. And for the lecturer too, you could choose to volunteer at the clinical side wherever you want to in your area that you want to also improve or still retain your skills. The nurse could also do that. It is possible depending on the individuals.
Okay, so certainly at this point, you know that we always advocate for you to be anything and everything you want to be. So go out there, fulfill your full potential, because actually nothing is impossible. This is a more complex question. It's more personalized towards you, and most times it's difficult for people, actually transitioning from student to professionals and then into the marital life, having to navigate being a nurse, a lecturer, a community health advocate, and many other aspects of your life, and also be a mother and wife. What steps would you advise to help people navigate through this?
Can you make that question simpler?
Okay. As a nurse, with so many aspects of your life that takes a lot of your time, and also having a family, what advice would you have for people to enable them to be able to navigate through that?
I would say it takes a lot of planning, and your mindset must be willing to carry that. For somebody like me, I will say that a supportive spouse too is one of those things that God gave me, and it's easier for me to navigate, and also a supporting family where I came from. So it's a lot of planning into that, depending on where you are, either clinical side or being a lecturer. I will say that we can not also have whatever we have not been given, like the Bible says. So I will say God's grace too is Very important.
Very important.
When the enablement is there, then it is possible.
So, and we all know that planning, dedication, and God are very key aspects to whatever you have to do. So now this is directly from the horse's mouth. Someone that has been very successful in this field. This section of questions is directed towards students that would want to dive into the academic section. Now, as a student aspiring to study and further their education and go into the academic setting, is there any academic criteria? Do they have to be first class students? Is there any criteria required for them to thrive in this system?
Teaching is a skill. I have observed that for those that are even very intelligent, they find some find it difficult to really express, to teach somebody else.
Yes, somebody.
So for them to even understand what they're trying to say. So it's a skill that can be gotten. It's a skill one can build and also leverage on. Okay, so all the person needs to do is connect with the path and begin to navigate. If that is the path the person's creator
God factor
wants them to be, so it's going to work out. But for an academician, the person must know that the first, the second, and every other degree matters, if that's the path.
So that answers the question. Just further your education to the best of your ability and also get the required skills.
And I would also like to include that what you want to be, the person will start working from the beginning to be that person, to improve that 1% every day, to work towards that path. So if you want to be a lecturer, then you know that you take the studies very seriously. You study, there will be research, a little bit of all, so that one, by the time you now get, by the time you get there, you will be equipped, you have all it takes to.
Do you think that it is important to have bedside experience before coming into the educational system?
Personally, I would say that the bedside experiences I've had has really assisted me as a lecturer, because most of the examples I give in class are my personal experiences with patients or interacting with colleagues and all of that. So to have a good base, good foundation, a good grasp of whichever area you want to navigate, it's always good to have the practical experience. Now depends on the individual, but the way the after school degree is structured now, internship, service. So that 2 years at least will still expose that person to. So it's now expected for the individual to utilize everything the person could see and interact with at that time effectively.
That's actually great to hear. So now there is this discourse about the difference between College of Nursing and University Nursing. Which do you think better prepares nurses professionally for the practice?
Both prepares at their level.
That's a very political answer.
They prepare at their various levels. Yes, when the hospital-based nursing practice started, they are just meant to maybe give some practical nursing skills, knowledge to the nurses and release them to start. And that is sufficient for that level at that time. And for somebody to have a Bachelor of Nursing Science, you will know that all bachelor degrees have a standard and a structure. Definitely. And that is also included in nursing. Yes, maybe those are the colleges of nursing have more practical experience because that's the way their academic calendar is structured. The BNSC students too, they're expected to also have some level of exposure, but the way the curriculum is structured might not accommodate a lengthy time and it has now been filled up with the internship currently run. Okay, so I would say that at the different levels, they will be able to perform at the knowledge and skills they are exposed to. I will not say which one is better than the other. However, I will still say that in our Nigeria of today, having a bachelor's degree will still be better than anything lesser than that. Because I've had the opportunity to hear somebody that decide the civil service, and they always say that if you don't have a bachelor of, if it's a BA in anything or bachelor in any course or discipline that you are rated at a particular, less. So while it's better to have a bachelor, so I would say that having a bachelor of nursing science is still much more better than if one has the opportunity and have the necessary information.
As a student nurse, as a professional, there's this tension between graduates of the College of Nursing and the university. What do you think follows that tension or the
If I was sincere with you, I would say it's low self-esteem. Why? Because I have navigated this far. Let me share a personal experience. As a direct entry student here that year, I already have let me say I'm already a registered nurse, I'm already a registered midwife. When I say direct entry, full-time, not the ODL. Okay, so, and I'm vividly seeing that occurs at the female surgical ward 2 right now. As soon as we got into the ward, you could see the School of Nursing students already picking and saying, they don't know us. So, yes, so. And when they assigned duties to us, like they used to do, patients, they gave us, I don't know if those ones are still there now. Some ones can be very good for medical ward too. So they gave us those type of ones. And somebody like me is fine. I've known those type of ones beforehand. They were surprised. The second day, we were given again. The third day, now I want to meet the nurse. That's why have we been assigned to this every day? Was it because we did it well, or what were you trying to prove? And she wiggled out. That very day, one of them picked a quarrel with me. I was like, I just kept my quiet because what are you trying to prove? I've done this before. If it is appropriate, why am I here again? But yet, we all know the path we want to go through. Yes. So, I will say that students, wherever they are, I've also been a student. I've worked somewhere too before where the UI students came to for clinical postings. I never envied them because I know I'm still going there. And I was so receptive. I know they didn't know some of the things I knew. I was willing to put them through. Not to embarrass, not to fight them. Yes, we are all nurses and we should work together to move the profession forward. Not to be enemies of each other or one another. When we have other enemies,
I think that really affects our interaction and our group as a nursing community.
So I'll say that whether you are a College of Nursing student or you are a Bachelor of Nursing student, the two of us, we are all student nurses. Take the weaknesses of this person in the college. The BNSC students should put the strength there. When you see a weakness in the BNSC students, let the strength you have as a college student, log it in so we can work together to make our patients have good outcomes and we build our skills to be better nurses as we go.
So, I think this is very insightful. Whether you are a College of Nursing student, you are a nursing professional, you are aspiring to go into the educational field, you should really pay attention, get your notepads, rewatch this episode, and if you've not subscribed, go ahead and subscribe, leave a comment, share your thoughts, and let's know what you have to say. Now, about this whole strengths, weaknesses that you mentioned, are there any particular unique strengths and weaknesses that we could identify for each class and how we could cover up for those weaknesses and enhance those strengths?
I just say that as individuals. Yes, I might be a BNSC student. You might see some weaknesses in me. Might not be related to nursing. It might be my personal. It is not yours to go expose at the College of Nursing students. It is for you to block that area, fill it with your strength, while I do the same for you. So it's not particularly about maybe skills or the profession as such. But like I said before that, maybe the College of Nursing students might have more clinical exposures because of the way their curriculum is structured. Okay, a Part 3 student in the College of Nursing will have maybe more clinical exposure than the Part 3 in the PNSC. If you see something lacking, it's just for you to, inform and also take the time to let that person know instead of biting or, go to report to the senior nurse.
And now we know that the Nigerian system already has so many loopholes, and with your experience, with your level of knowledge, if you could redesign the Nigerian nursing educational system, what particular things would you change?
There will be no College of Nursing. All of us will be PNSC. Why? Because we are shortchanging ourselves. Okay, from the new college, I think we start having their graduates maybe in another year or maybe in 2 years. What is their next path? Is it internship? Is it NYSC?
I think there's this news about them starting internships. So
if they now want to go for BNSC, we are thinking like every other polytechnic, they will have to do a PGD first. Why not affiliate everyone with the university and let us all have a BNSC?
yes.
Then when I say that, some people will say, that's too rigid. Let's see have that while we also have the universities, and each individual could pick the path they want to follow. Okay, so personally, I will advocate for all of us doing universities.
I think I would agree with you on that, considering the fact that there is no school of law or school of engineering or all of that. So that's
School of pharmacy.
that's actually a great scope to redesign the nursing education system. Okay. Ladies and gentlemen, we've come to the end of this episode, and if you've not learned one thing, I guess you've learned like 10 things, because there's no way you learn just one thing from this episode. So just end this episode. If you're leaving something for the viewers, people that are student nurses, nursing professionals, people that are looking to transition into the academic system, what's that one thing you would leave with them to go with the end of it?
Who do you want to be? Know what or who you want to become, and just pursue the path.
Ladies and gentlemen, to this question, who do you want to be? I am Nathan Ishwa, and I'll catch you on the flip side. Thank you.